Hello, I'm Dr. Charles Masarski. I'm an adjunct instructor at Northern Virginia Community College in Annandale, Virginia, as well as a doctor of chiropractic in private practice in Vienna, Virginia. The following story will describe a few moments in the life of a fictitious Major League Baseball player. Hopefully, you'll find it entertaining as well as informative. As you will see, the backstory to these few moments involves a concussion. You'll be asked several questions along the way. Pause the video when you come to these questions. If you have already studied the nervous system to some degree and have some understanding of the effect of concussion on the nervous system, you will be able to answer some or all of these questions before I give you the answer, which I will do a few seconds after I pose the questions. For you, this will be a good review. If you have not studied the nervous system to any significant degree, this story will introduce you to several concepts that will prove useful should you undertake such a study in the future. Most of the Yogi Berra quotes in this story are from the Yogi book by Yogi Berra, Workman Publishing, New York, 1999. And now, it is my pleasure to present Mo's concussion. You gotta believe. This story recounts the major events in selected central nervous system pathways in a baseball player during a single at-bat. The setting is the bottom of the ninth inning of Game 7 of the World Series, in which the Boston Red Sox are ahead of the Washington Nationals 3-0. The Nats have 2 outs, but they also have the bases loaded with 3 adrenaline-soaked runners. Dual loyalties in the Washington, D.C. hometown crowd have pitted brother against brother, sister against sister, cousin against cousin, mom against dad, and some fans even cheer both teams on, actually pitting left brain against right brain. Wherever you are reading this, the time is next year. You gotta believe. Taking his last warm-up swing in the on-deck area is the Nats' last hope, Moshe Ibrahim, acquired just this year from the Jerusalem Artichokes, a joint Israeli-Palestinian franchise. Now you really gotta believe. The hometown crowd is chanting, "Let's go, Mo! Let's go, Mo!" When you come to a fork in the road, take it. Yogi Berra. As Mo Ibrahim steps towards the batter's box, the sun shines directly on his back, stimulating free nerve endings in his skin specialized for the detection of temperature changes, thermoreceptors. If the afferent or sensory signals from the thermoreceptors are processed by the cerebral cortex, Mo will experience the conscious perception of warmth. Since Mo's back became sunburned earlier in the series, this sunshine will also stimulate other free nerve endings specialized for the detection of noxious stimuli, nociceptors. If the afferent signals from the nociceptors are processed by the cerebral cortex, Mo will experience the conscious sensation of pain. However, before any signals reach the cerebral cortex, they encounter a fork in the road. If they take one fork, the signals are headed for processing as conscious warmth or pain. If another fork is taken, the signals will exert an unconscious influence on brain circuits that affect emotion and alertness. Where is that other fork going? What are the systems of brain circuitry that affect emotional state and alertness? In addition to the pathway that leads to the cerebral cortex, the afferent signals from the thermoreceptors and nociceptors travel through a tract that is much older in evolutionary terms. This older tract leads to 2 important systems in the brain: the limbic system, which influences emotional state, and a reticular activating system, which influences alertness and wakefulness. You've got to be careful if you don't know where you're going, because you might not get there. Yogi Berra. During his walk to the batter's box, Mo is not watching his feet. He's trying to fully take the moment in. Therefore, he's looking at the pitcher, the crowd, the scoreboard, the sky, pretty much anything but his feet. If his knowledge of where he was going depended on visual contact with his feet, he might not get there. Fortunately, sensors in Mo's skin, joints, muscles, tendons, and ligaments keep his nervous system informed about the location and actions of his feet and every other part of his musculoskeletal system. These sensors, which are called mechanoreceptors, feed their afferent information into spinal nerves. Conscious perception of positional information from mechanoreceptors is called proprioception, while movement perception is called kinesthesia. The cerebellum is where NAC lives. Only a fraction of Mo's mechanoreceptor information reaches the cerebrum for conscious proprioception and kinesthesia. A great deal of information is destined for the cerebellum, where unconscious processing of body position and motion takes place. This information is coordinated with information from the inner ears. All of these inputs are integrated with visual information to assist the cerebellum in its task, smooth coordination of motor function, including balance. Walking, running, and all other human activities depend on these cerebellar connections. Mo's knack for batting has a great deal to do with inborn connections and conditioned reflexes within his cerebellum. To a large extent, the cerebellum is where knack lives. There was a time, only a few months ago, when Mo's knack was in serious trouble. The chanting of the crowd would have distracted Mo. The sunburn would have disturbed his mood, and his walk to the batter's box would not have been smooth. He probably would not have made it to the World Series. In fact, he might not even have made it to spring training. Here's the backstory. Commuting and combat are supposed to be two different things. While living in Jerusalem, Mo was accustomed to using the bus for most of his transportation needs. When he moved to the Washington area, he frequently found himself in a car on a bewildering set of roads among drivers who frequently confused commuting with combat. Not surprisingly, he soon had his first auto accident. Unfortunately, this happened just a few weeks before he was to report to spring training. His neck pain and headache were driving him crazy, so he decided to see a doctor. At first, he got what he thought was reasonably competent conventional care. The diagnosis was damage to the muscles and tendons of the neck, cervical strain. An additional diagnosis was damage to the ligaments of the neck, cervical sprain. He was sent home with a cervical collar and a prescription for muscle relaxants and non-steroidal anti-inflammatory drugs, or NSAIDs. A series of physical therapy appointments was set up. The collar and drugs took a bit of the edge off the pain, but not much. Mo was still quite uncomfortable. Both Mo and his doctor assumed that the stubbornness of the pain indicated that the cervical strain from the accident was more severe than it initially seemed. Even more disturbing than the continued neck pain and headache was the fact that Mo's physical therapy was not going well at all. He seemed to have trouble concentrating during his therapy sessions. He also found himself uncharacteristically moody and irritable. He would often argue with his therapist. At one point, he suddenly stormed out in the middle of a session. Sometimes he was late for his therapy session because he couldn't remember where he put his car keys. Both Mo and his doctor assumed that these emotional and cognitive problems were due to the stress of the accident combined with the time pressure of the impending spring training deadline. A new player joins the team. The deadline for spring training was approaching fast, and Mo felt far from ready. He began to wonder if it might not be a good idea to add another player to his healthcare team. On the recommendation of one of his teammates, Mo called a chiropractor, Sam Morikubo, D.C. Mo was encouraged by what this chiropractor told him over the phone. While there is no way to know for sure whether or not a particular patient will respond, long experience had taught Dr. Sam that most whiplash patients respond very well to chiropractic care. Dr. Sam also mentioned that injured athletes have been benefiting from chiropractic care for many years. Baseball in particular had a long history of injured players benefiting from chiropractic care, including such past greats as Babe Ruth, Joe DiMaggio, and Lou Gehrig. In any event, taking care of people with neck pain and headache is part of a chiropractor's regular day at the office. Mo made an appointment. You don't have to hit your head to hurt your brain. During the case history, Mo detailed his difficulty in remembering his car keys, his inappropriate outbursts during physical therapy, and his inability to concentrate. He also was asked to rate his neck pain and headache on a 10-point scale. He detailed his health care for the injury to date. Dr. Sam asked, "What did they do about the concussion?" Mo replied, "What concussion?" "Doc, maybe you don't follow. I had a whiplash accident. I didn't hit my head. I never passed out." "Listen, Mo, I do follow. You don't have to hit your head to hurt your brain. You don't have to pass out either. Your combination of symptoms sounds like concussion to me." Where is Dr. Sam getting this from? Like Mo, most people think you have to be knocked out by a blow to the head to have a concussion, also known as mild traumatic brain injury, or MTBI. More recent evidence from such sources as CDC and an effort called the Zurich Conference informs us otherwise. Classic symptoms such as headache, memory loss, concentration problems, and mood swings were sufficient to alert Dr. Sam to the likelihood of concussion. What should Mo's previous healthcare providers have done about the concussion, especially in terms of advice to the patient? Immediately following the concussion, Mo should have been resting. This rest should not only be physical, but should also include rest from mental exertion, also known as cognitive rest. Physical and cognitive rest are particularly important for the first 48 hours after a concussion. As Mo's headache, memory loss, concentration problems, and mood swings wore off, activity could be reintroduced. Non-steroidal anti-inflammatory drugs, or NSAIDs, are not a good idea right after a concussion. They can cause small, undetected areas of bleeding in the brain to become worse. Muscle relaxants have to be used with caution due to their adverse effect on some patients' balance and coordination. After the case history, Dr. Sam performed a chiropractic examination which focused on range of motion, postural analysis, static and motion palpation, reflex and dermatome testing, and manual muscle testing. X-rays from previous practitioners were reviewed. Not surprisingly, the findings were consistent with multiple misalignments or subluxations, particularly in the cervical region on the right side. There was a right sacroiliac subluxation as well. Also, Dr. Sam felt it was important to assess some functions relatable to concussion to aid his clinical decision-making going forward. He recited a series of 3 digits and asked Mo to repeat them backwards. No problem. When he did the same thing with 4 digits, Mo failed to repeat them backwards accurately. What's that for? What brain functions are being challenged in the test Dr. Sam just performed? The test Dr. Sam just performed is called reverse digit span. Memorizing a series of digits, holding that list in your mind long enough to repeat them in reverse order requires short-term memory. Short-term memory will be disturbed when attention span is short. So reverse digit span is a test of attention span which depends on a normally functioning reticular activating system, the alertness-wakefulness circuitry we mentioned before. Most normal adults have the ability to recite a series of 5 to 6 digits in reverse order. Mo's reverse digit span was 3. Dr. Sam asked Mo to stand on his left leg for 30 seconds, then his right. Mo timed out at 29 seconds on his left and 15 seconds on his right with his eyes open. Dr. Sam did not ask him to balance with his eyes closed. Mo smiled. "Not so bad, huh, Doc?" How bad was it? Was Mo's single leg balance time within normative values? If not, how bad was it? Does your answer take into account that he is a professional athlete? Why did Dr. Sam opt to omit single leg balance testing with the eyes closed. The ability to stand on one leg, single leg balance, is a test of how well the cerebellum coordinates information from the mechanoreceptors of the joints, ligaments, muscles, and tendons with visual and inner ear information. With eyes open, an average adult should have a single leg balance time of at least 30 seconds. Mo is a professional athlete, and as such is expected to have superior cerebellar function. 29 seconds on the left and 15 seconds on the right is not good. Sometimes an examiner will repeat the single leg balance test with eyes closed. This is more challenging because you're depriving the cerebellum of visual input. Noting that Mo had trouble with his eyes open, Dr. Sam opted to skip the eyes closed phase rather than risk a fall that could further injure his patient. Dr. Sam asked Mo to elevate his arms, then slowly touch the tip of his left finger to the tip of his nose. This was repeated on the right. Then Mo was asked to repeat the finger-to-nose test with his eyes closed. He completely missed his nose on the right side. Why can't Mo find himself? What does Mo's failure with the finger-to-nose test potentially say about mechanoreceptor information and cerebellar function? With Mo's eyes closed, he depends on mechanoreceptor information to tell him where his arms, hands, and fingers are located in space. This information travels through spinal nerves in the neck before going on to the cerebellum for coordination. If the misalignments or subluxations in his neck are irritating his cervical spinal nerves, he is getting false mechanoreceptor signals to a cerebellum that is already struggling with concussion. Dr. Sam explained, Mo, two things happened to you in that car crash. You did get a concussion. Also, you have several pinched nerves in your neck and elsewhere in your spine. We call these pinched nerves subluxations. Mo was puzzled. Why not just call them pinched nerves, Doc? Dr. Sam replied, because the word subluxations has more syllables. After all, I am a professional. Here's the important point, Mo. A concussion is an energy crisis in the brain. Subluxations send bad information to the brain. The last thing a brain in energy crisis needs is bad information. I'm going to do a series of chiropractic adjustments to deal with the subluxations. With your permission, I also want to consult with your physical therapist to coordinate care. In particular, I want the therapist to shift her emphasis from sprain and strain and instead work more on your balance. Dr. Sam set up a chiropractic care plan with periodic progress exams. Adjustments gave Mo considerable relief from his neck pain and headaches. Mo also found his concentration and emotional stability returning to normal. How come? If the concentration and emotional problem stemmed from the concussion, why would adjustments make any difference? Remember that Mo was experiencing neck pain, which certainly was related to his cervical subluxations. He also was experiencing headaches, which were probably due to the combined effect of the concussion and the subluxations. This means that free nerve endings, nociceptors, were being activated. This influences the reticular activating system and the limbic system. Correcting the subluxations was helping Mo normalize his information flow not only to his cerebellum, but also to his limbic system and his reticular activating system. The result was improved concentration and emotional stability. Thanks to Dr. Sam's adjustments, Mo's recovery accelerated. His pain was resolved and his neurological testing results improved dramatically. The physical therapist and Dr. Sam both felt Mo was ready to report on time to his first spring training with the Nats. These guys don't understand the game. Before Mo left for spring training, Dr. Sam tried to impress on him the importance of following up with chiropractic care while in Florida. He also prepared a written summary for Mo to give to his trainer and batting coach. In addition to recommending continuing chiropractic care, Dr. Sam suggested a gradual approach to spring training to respect the concussion. Mo relayed the advice to Big Mark, who was both his trainer and batting coach. It's not that Big Mark ignored Dr. Sam's summary, he never even read it. Big Mark could tolerate physical therapists up to a point. He had less patience with medical doctors, especially if they weren't sports doctors. He didn't take chiropractors seriously at all. Only trainers and coaches really get it, he felt. As far as these other people were concerned, Big Mark's philosophy was these guys don't understand the game. Unfortunately, Mo went along with Big Mark and ignored Dr. Sam's advice. The slump. Spring training went well at first. However, as opening day approached, Mo experienced a frustrating decline in his batting and fielding skills. At first, Mo would play well for 8 innings during exhibition games, and then he would fall apart. He kept on misjudging in all aspects of the game. It was as if he couldn't take his movements for granted. He had to focus on where his hands and feet were while simultaneously swinging the bat or making a play. Yet no matter how much he concentrated, no matter how much extra training he took, his timing remained just a bit off. He could not consciously will himself to be more accurate. As time went on, the problem appeared earlier and earlier in the game. Mo almost felt as if the concussion is coming back. Big Mark was certain Mo was just in a slump. More intense practice would take care of it. So, is this just a slump, or what? Is it possible for concussion signs to be absent on examination, appearing only with exertion? Yes. Please remember, concussion is an energy crisis in the brain. What the brain can handle when it's fresh may not be the same level of activity it can handle after several minutes or hours of high demand. A concussed athlete, student, or worker needs to increase activity levels only to the point that does not bring back concussion symptoms. In Mo's case, he should play full games only when his brain regains the necessary endurance. Also, he should have continued chiropractic care so as to not complicate his post-concussion problems with subluxations. Big Mark's intensified practice schedule did not help Mo's game. After the first few games of the regular season, the Nats manager sent Mo to the Potomac Nationals, the Northern Virginia minor league team. There was serious talk about the slump being a career-threatening problem. Mo decided it was time to see Dr. Sam Morikubo again. Dr. Sam found the signs of cervical and sacroiliac subluxation had returned, along with deterioration of single-leg balance time and the finger-to-nose test. He set up a series of visits for chiropractic adjustments during the Potomac Nationals homestands. Before each road trip, he also made appointments in advance with a doctor of chiropractic in the host team's hometown. After a while, Mo's recovery had progressed to the point where adjustments on the road were usually not necessary. Follow-up would simply take place when Mo was home. The subluxation signs had abated and single-leg balance time had improved. This finger-to-nose test was now negative. Fielding and batting skills returned to pre-accident levels for which the minor league coaches and trainers took full credit. The slump was over. Mo's knack was back. The major league team's manager called Mo back up to the show. He resumed his position in the Nats' regular lineup. Mo Ibrahim's most recent visit to Dr. Sam Morikubo took place a few hours before the game described in this story. We now return to that game. Red Hot Rudy never tells. Now, Mo focused all of his attention on the pitcher. After the Nats loaded the bases, the Sox manager had replaced the closer with the player considered by many fans to be Boston's secret weapon, a pitcher's pitcher, a finisher, a terminator. The replacement closer, Rudy Gonzalez, was capable of throwing almost any sort of a pitch. However, his best pitch was the fastball, which he could deliver with record-breaking speed and pinpoint accuracy. It was this skill that earned him the nickname Red Hot Rudy. With 2 outs under his belt, Rudy prepared to unleash his final red-hot volleys against Mo, making good the Sox victory. The news entertainment media carried many unsubstantiated rumors about Red Hot Rudy in the course of the season. In addition to the usual suspicions regarding the use of human growth hormone, testosterone, and other performance-enhancing drugs, some of the less credible tabloids had published truly amazing allegations. A secret research team at MIT had injected Rudy with nanotechnology, which instantly repaired his rotator cuff following each superhuman pitch. Rudy was not in fact human at all, but was an alien android hybrid fashioned by off-world civilizations to look like a human. Other stories offered lurid accounts of Rudy making a pact with the devil. In addition to these unflattering explanations for his performance on the field, Rudy was reported to be a sort of anti-paragon off the field. Rumors described huge orgiastic meals, complete with drinking and drug use immediately before game time. Somehow, this overindulgence did not hamper his pitching performance, lending yet more fuel to the above-mentioned technological and metaphysical speculations. Risk factors? If in fact Rudy were indulging in excessive drinking and drug abuse, could this increase the risk of a concussion and/or increase the risk of complication should a concussion occur? Yes. Needless to say, the disturbed attention and coordination created by abuse of alcohol and other recreational drugs increase the risk of an injury. That could include a concussion. Also, if a concussion does occur, the last thing a brain and energy crisis needs is a central nervous system depressant, such as alcohol. In fact, despite these dubious reports concerning his off-field exploits, Red Hot Rudy was a consummate professional on the field. It was the consensus of his teammates and every credible reporter that he was simply a talented, dedicated, drug-free player. Still, the sensational press continued. Almost every week, at least one woman would arrive at the emergency room of a hospital in the city where Rudy was staying with reporters in tow. These women complained of severe exhaustion following epic bouts of amorous gymnastics with the pitcher and demanded emergency medical help. When a tabloid reporter asked him about these complaints, Rudy simply smiled and stated that he never discussed private matters about any lady of his acquaintance. The tabloid gleefully put him on their front page under the headline, "Red Hot Rudy Never Tells." Of course, a tell was exactly what Mo hoped he had found. He was watching Rudy closely during the previous 2 at-bats and thought he detected an eyebrow twitch every time Rudy pitched low and to the inside corner of the plate. Rudy prepared to pitch. He checked the base runners in a perfunctory way since it was quite unlikely that anyone would risk stealing a base under these circumstances. Just before he released his pitch, Rudy's eyebrow twitched. Mo caught the twitch and made a conscious decision to swing hard towards the expected low and inside pitch. His swing delivered the bat at just the right place to hammer the expected low and inside pitch. Sadly, Rudy had fired his fastball high and inside. The umpire bellowed something indecipherable, but Mo understood him to mean strike one. Washington fans tried to focus Mo by screaming at him. Mo modified his theory of Rudy's eyebrow twitch. Perhaps it was a different sort of a tell. Maybe it didn't convey anything about the height of the pitch, only that the pitch would be inside. Rudy's eyebrow twitched again. The release looked like the ball would go inside again. Mo made a beautiful swing at the expected high and inside pitch. Sadly, the low fastball zoomed right by him on the outside corner of the plate. Another bellow erupted from the umpire, presumably translatable as strike two. The Boston fans, sensing blood, were on their feet, roaring syllables that were not part of any known human language. You can't think and hit at the same time. Yogi Berra. Mo decided there was nothing to be gained by thinking too deeply about Rudy's cryptic eyebrows. Rudy would pitch whatever he pitched, and Mo would try to hit it, period. Maybe not a very sophisticated approach to what might be the final pitch of the World Series, but Mo felt he had to try something different. Rudy released the ball. Mo's bat just barely grazed Rudy's third fastball, tipping it into foul territory. Mo called for a timeout. The stadium became a good 80 decibels quieter. Many fans of both teams were slowly moving their lips in barely audible prayer. One Boston fan closed her eyes and visualized metaphysical energy descending to Rudy through mystical openings in a Kabbalistic diagram. A Washington fan visualized energy rising up the yogic chakras of Mo's body. In the aisles, sand paintings were quietly drawn in the Native American and Tibetan styles. Neo-pagan chants could be heard, invoking the denizens of Olympus, Valhalla, and parts unknown. Wiccan spells were cast. Strange dances were danced. Exotic incense was burned. Mo closed his eyes and tried to center himself. It occurred to him how striking it was that he couldn't even touch the ball until he stopped trying to calculate his opponent's pitch. Maybe he had been overthinking. At least 90% of this game is half mental. Yogi Berra. Mo recalled a conversation he had a while back with his chiropractor, Dr. Sam Morikubo. They had been discussing a certain type of special mental state that can sometimes be achieved. For an individual to experience it more than once in a lifetime would be memorable. To experience it over and over again would be extraordinary. Some people would never experience it at all. During one of these peak experiences, a person could tap into a vast reservoir of information and energy that is not consciously available, but is somehow stored at a level much deeper than the level of ordinary awareness. Both modern psychological theories and ancient wisdom traditions make mention of such a reservoir. Dr. Sam told Mo that traditional chiropractic principles mention such a reservoir as well. However, to tap into this reservoir, one's conscious obsessions had to get out of the way. To Mo, this has seemed a bit corny, like some old-time science fiction stuff about becoming one with the Force. On the other hand, it certainly was true that Mo couldn't touch Rudy's fastball at all until he stopped thinking so much. He recalled an old saying that 90% of the game is half mental. Certainly, Mo had put years of conscious mental work into honing his skills. He had taken good care of the part that is half mental. But what about that other half? 90% of the game must be half not mental. There must be something else that isn't thinking at all. Can a player's mind jam their own circuits? Can a player's thinking be so internally loud that their body can't hear itself think? He decided to stop overthinking his swing. He would stop thinking of himself as swinging the bat at all. He would simply be the act of swinging. He and the bat and the ball would all be components of a swing that was as inevitable as gravity. He would get his mind out of the swing's way and let it happen. He wouldn't make the swing. He would stop interfering so the swing could happen through him. As soon as Mo made this decision, there was a subtle relaxation of tensions in his body. He felt as if these tensions had been holding him back up until that moment. Now, there would be no interference. Moshe Ibrahim opened his eyes and stepped to the plate. Rudy Gonzalez sent a sizzling fastball toward the outside corner of the plate. Mo felt his body move as if it had a mind of its own. Then he experienced the crack of the bat against the ball, almost as if he were merely a close observer. As soon as that cracking sound reached his ears, Rudy understood. The pitcher gravely tipped his cap to Mo. Startled out of his near meditative state by Rudy's unexpected gesture, Mo looked up and realized the ball was still in the air. As he took in a deep breath, the ball began its graceful downward arc. Then, with the authoritative precision of a punctuation mark, it landed right in the middle of the center field stands.